I am Luke, an architect from Sydney. Last month, while inspecting a project in Chongqing, I suddenly experienced severe abdominal pain in the middle of the night and was rushed to a nearby top-tier hospital. From the moment I stepped into the emergency room, I felt a completely different medical experience. The triage nurse immediately arranged a CT scan, and I was diagnosed with acute appendicitis that required urgent surgery. What surprised me was that it took less than an hour from diagnosis to entering the operating room. The chief surgeon could communicate with me fluently in English and patiently explain the surgical plan. The anesthetist detailed the anesthesia procedure and precautions. Even the nurses thoughtfully used translation apps to communicate every detail with me. What impressed me the most was the efficiency of the surgery. Using laparoscope minimally invasive techniques, the incision was small, and I was discharged smoothly 3 days after the operation. And the total cost, including emergency care, tests, surgery, and hospitalization, was only a fraction of what I would have paid out of pocket under Sydney's healthcare system. In Australia, that amount might not even cover the cost of an ambulance. Reflecting on my experience in Australia, where a colleague with the same acute appendicitis had to wait 6 hours in the emergency room before surgery could be arranged, I truly felt what life comes first means in China. The healthcare here is not only efficient and professional, but also makes patients feel respected and cared for. This experience completely changed my preconceived notions about the level of medical care in developing countries.
Here is the step-by-step process for an American patient seeking medical treatment in mainland China, the Rural CN Hospital services. Initial consultation and booking, the patient contacts the CN Hospital customer service team via email or phone to discuss their medical condition. The team assists the patient in selecting the appropriate hospital and doctor in mainland China and confirms the appointment booking. Flight arrangement, the patient proceeds to book their flight according to the confirmed appointment time. Accommodation arrangement, the customer service agent contacts the patient to confirm the hotel class and pricing. The agent then makes the hotel reservation for the patient. Arrival in mainland China, the patient travels to mainland China independently, arriving 1 day prior to the scheduled appointment time. A dedicated medical guide from CN Hospital will meet the patient at the airport and transfer them to the reserved hotel for check-in. Hospital visit and treatment day, early the next morning. The medical guide will pick up the patient from the hotel and accompany them to the hospital. The guide will escort the patient directly to the doctor's room and provide full assistance throughout the entire visit, including various examinations, fetching prescriptions divided by medicine, and accompanying them during surgery. Departure. Once the medical treatment is complete, the medical guide will escort the patient to the airport for departure.